Hello friends, and welcome back to our channel. Your heart pumps blood throughout your body non-stop, but what happens when it has an issue? Heart valve disease can develop subtly, but if you know what to look for, you can see the warning signals. We're going to explore the top 10 heart valve disease warning symptoms today, which you should never ignore. Stay with us until the end to find out how you can take action to protect your heart health. Let's get started. Let's start by defining cardiac valve disease. When one or more of the heart's valves malfunction, it can lead to heart valve disease and impair blood flow through the heart. The four heart valves, pulmonary, tricuspid, aortic, and mitral, ensure that blood flows in the proper direction. With every heartbeat, the flaps, also known as cusps or leaflets, on each valve open and close. A valve may occasionally not open or close all the way. This may alter the way blood travels from the heart to the body's other organs. Heart valve disease comes in the following forms. Stenosis. The valve flaps can occasionally merge together and get thick or stiff. The opening of the valve narrows. The reduced valve's capacity to flow blood is reduced. Recurrence. Blood leakage backward can occur if the valve flaps are not closed tightly enough. Prolapse. The valve flaps get floppy and stretched out. They protrude rearward akin to a parachute. Regurgitation may result from this illness. Atresia. There is no valve formation. A thick layer of tissue obstructs the blood flow between the chambers of the heart. The pulmonary valve is often impacted by this kind. Some individuals are born with heart valve problems. This is known as congenital heart valve disease. However, adults are also susceptible to heart valve problems. Adult heart valve disease can be caused by infections, age-related changes, or other heart problems. Risk factors for heart valve disease include aging and certain illnesses, such as rheumatic fever or blood infections, heart attack or some type of heart disease, high blood pressure, high cholesterol, diabetes, and other cardiovascular risk factors. Heart valve dysfunction can lead to consequences such as heart failure, stroke, blood clots, irregular heart rhythms, and death. Let's understand what are the warning signs of heart valve disease. The first item on our checklist is shortness of breath. If you find yourself getting winded from basic activities like walking upstairs or even while relaxing, it could be more than just a lack of fitness. When your heart valves aren't working properly, they may struggle to circulate enough oxygen-rich blood throughout your body, leaving you feeling breathless. So if your shortness of breath is becoming more regular, it's time to take action. Persistent fatigue comes in second place. Everyone gets tired from time to time, but chronic tiredness that persists even after resting could be a warning sign. When your heart valves fail, your heart needs to work harder to pump blood, leaving you fatigued all the time. If you're fatigued after completing simple things like getting dressed or doing light housework, consult your doctor. Number 3 is chest pain or discomfort. Chest pain is commonly associated with heart attacks, but it can also be an indication of heart valve dysfunction. This pain may manifest as pressure, tightness, or discomfort, and it might come and go. If you get chest pain that lasts more than a few minutes or occurs regularly, don't wait, get it checked out right once. Heart palpitations come in at number 4. Have you ever had your heart miss a beat, flutter, or pound unexpectedly? Palpitations can be an indication of arrhythmia, which is frequently caused by heart valve problems. While infrequent palpitations aren't necessarily reason for alarm, frequent or severe palpitations may indicate a more serious condition that requires medical treatment. Number 5 is swelling in your legs and ankles. Poorly functioning heart valves can cause blood to collect in your lower limbs, resulting in swelling or edema. If you see chronic swelling, particularly at the end of the day or after standing for an extended period of time, it could indicate that your heart isn't pumping blood efficiently. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Number 6 is dizziness or fainting. A malfunctioning heart valve can restrict blood supply to the brain, resulting in lightheadedness, dizziness, or even fainting spells. If you've had any of these symptoms, especially while standing or exerting yourself, You should consult a doctor to see if your heart is the cause. Number 7 is an irregular pulse. Abnormal heart rhythms, such as atrial fibrillation, are frequently associated with heart valve disorders. You may experience heart palpitations or detect an irregular heartbeat. A simple check with your doctor will help determine whether an erratic heartbeat is due to valve disease. Number 8 is rapid weight gain. If you've suddenly gained weight that isn't connected to diet or exercise changes, it could be due to fluid retention, a typical side effect of heart valve problems. When your heart is unable to pump adequately, fluid accumulates in your tissues, producing rapid weight gain. Number 9 is a cardiac murmur. A cardiac murmur is an irregular sound produced when blood passes through a defective valve. It is frequently noticed during routine checkups. While not all heart murmurs are significant, if your doctor identifies one, more testing may be required to rule out heart valve problems. 10th and last, trouble lying flat. A disease known as pulmonary edema, which is frequently linked to problems with the heart valve, may be the cause of your discomfort when lying down if you have shortness of breath or chest pain. People who have this symptom frequently discover that they must sleep with their heads propped up on pillows. Now that you've learned the top 10 warning indicators, how can you protect yourself? The good news is that heart valve problems can be treated. Early detection is critical, so don't hesitate to contact a healthcare expert if you see any of these symptoms. Regular checkups, a good diet, and exercise can help keep your heart strong. Remember, this video is for informational purposes only and should not replace professional medical advice. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and comment down below with any questions or topics you'd like us to cover in the future. Thanks for tuning in, and I'll see you in the next video. Disclaimer: this publication serves purely as an informational resource and should not be construed as a substitute for professional medical advice. For health-related concerns, it is strongly recommended that individuals seek guidance from qualified healthcare professionals. While every effort has been made to ensure the accuracy and reliability of the information provided, the publisher bears no responsibility for errors or omissions.